district.
Okay.
But I'm sending you, an email with the concern of the boombox, of your constituent.
Doctor, we
Okay.
will get together on that, on the legislation dealing with the mental health.
Absolutely.
And,
Okay, so just let you know.
Council Lady Santana wants to, sit in with us. I just have to do my to-do list today, and then I will reach out to you so that we can meet sometime this week on, the 911 for mental, health issues.
Great.
In the city of Cleveland.
Great.
Do you have any more reading for me to do? I mean, you gave me some.
Yeah, that's good.
All right. Do you
Yeah.
have any more you can give me later today?
Sure, always.
All right. I'll give a package to, give me a package and I'll give it to Council Lady Santana.
Okay.
She reached out to me when we were in the National League of Cities. That piece is very, very important.
Yeah, absolutely.
All right. And Park Place. I stopped by HUD. Matter of fact, we did, Council Lady Gray and I, and Star, Councilman Star.
I followed along.
And we talked with HUD about that issue
Good.
of concern. So I want you to give me a progress review on that issue over there with Park Place.
Yeah, that's, to the chair, if you recall, that was the building and housing team that was working that one with us.
Yeah, but I told HUD I walked you over there also. You went over
I
there
was
with
there,
us.
yep.
And whenever there's rodents that's in there, environmental issues,
Yep.
then we have to do something about that. It was mainly African-American females,
Right.
but they're little children there walking around. And one of the reporters mentioned to me that one of the kids had bite marks on their arm.
Yeah.
And you should, as the health director, when you see things like that, you're supposed to move on it just like that. And even if building and housing haven't moved, you're supposed to help me to make sure that they move on that. It was African American, not just because it's African American females, but it was mainly women, single mothers in there with rodents at Park Place and little children. And they need our help. And that's why I went over to HUD.
Yeah.
But you went there with me.
Absolutely.
Right. And man, when I see things, even if it's not in my ward, and when you see things like that, you got to move forward on it. Even if I was in another city, whatever the case may be, and I see women and children, I mean, that's our job
That's right.
to deal with that. Women, infant, and children, and you the health director. And I'm serious about that. I like you a lot, Director. I think Mayor Bibb did a great job by picking you, but when we see issues and concerns, dealing with that is our duty and job, and I yield to you on that issue.
Through the chair, our vision is to be the most responsive, most trusted, most impactful health department in the country. And part of that is everything we can do to extend life expectancy in the city of Cleveland. And so that's the work that this team does, team behind me, and we will continue to do that.
I'm going to stop by there. I'm looking at maybe Wednesday, just to see where they're at. They said they're going to start rehabbing the place, and I'm going to stop by and talk with some of the residents that's
Great.
there to see what's going on, because they won't reach out to me. But on my walk, you walk 2.5 hours with me
That's right.
in the ward, talking with residents and those kind of things. That's important. Because a
right.
lot of them, they won't reach out to us, but they want to see that we're there.
That's right.
All right.
Great.
Ordinance number 228-2024 by council members Conwell and Griffin by departmental request. It's an emergency ordinance to amend section 241.05 in the codified ordinance of Cleveland, Ohio, 1976, as amended by ordinance number 812024, passed January 22nd, 2024, relating to food shop license and fees. This ordinance has been approved by the Law Department, the Finance Department, and I'm with the Health Director now, sir.
All right, through the chair, this legislation would amend our existing fees for restaurants, food service operators, retail food establishments. We are adding a fee as required by the Ohio Department of Agriculture and Ohio Department of Health for a mobile retail food establishment, low risk and high risk. The good news is that this particular mobile retail food establishment does not exist in the city of Cleveland in our jurisdiction. We're not entirely sure where it exists, but we're required by the Ohio Department of Agriculture to add this fee. And so we come to you humbly to add this amendment to our existing fee legislation. And with me to my left, Commissioner Wallace Chambers of Environment. And with me directly to my left is Tatiana Kiongozi, who's our District Supervisor in Environment, who oversees the food safety program. And we can answer any questions for you about this fee.
All right. I have no questions on this fee. Any questions? Council Lady? Councilmember Starr?
Through the chair to Director, when you talk about this fee and you saying that we don't have this kind of food license or this food operation, retail food establishment, this fee is added because the state is requiring us to add this?
Through the chair, that is correct.
And then through the chair, do we have any examples of how this actually works elsewhere, whether it's in Ohio or in the city of Cleveland or anywhere located? Like, what actually happens with this type of establishment?
Through the chair, that's an excellent question. So we get on weekly calls with all the local health departments across the state, and none of the local health departments on any of the calls that I've been on could come up with an example of this. But I think from the Ohio Department of Agriculture, they're just trying to be prepared with the possibility of such an establishment existing.
And through the chair, this is like an establishment or like a grocery store on wheels?
Through the chair, that is correct.
Yeah, I just, I'm in support of this through my colleagues, but I'm just trying to get an understanding of why the agriculture is doing this if we don't have no examples of what actually happens. That's just really odd to me.
No, Councilmember, even on the state law, as you already know, supersede us. And so when we pass ordinance and when we pass laws, it gotta just match. That's all he's doing. He's just upgrading it so it can match with the state policies and procedures. That's just where it's at.
Yep, I got you. Thank you, Chair.
With that, any questions, Councilman? Sign up ordinance number 228-2024. So that is passed. Here's a question to the commissioner. Do you visit or walk dealing with stores, or have you individually talked with council members to understand our issues and concerns in our neighborhoods?
Through the chair, I only talked to Mr. Polensek. Me and the director met with him once, but I haven't talked to everybody. I talked to, I think, Jenny Spencer a while back through email, but I haven't met everybody or talked to them. But I'm willing to set up an appointment and we can go through the wards. I have driven through the wards with Mr. Peterson in nuisance to look at issues, but I never went through with a councilman.
You should, this is just my advice, you talk with every single council member, try to figure out our issues and concerns. So that way, when you drive through Ward 5, you have an up-close view and a sensitive ear on what's going on, then you know what to look at. And then reach out to the council members. Environment was very, very important. The last guy that was there, I drove him hard. That's important. And you visit Harsh Ward, Councilmember Harsh Ward. You talk with him, so when you drive through, you know what's going on, and that's important. The other thing that I think that with health, and I mentioned it to the director, but you guys don't do it. And when we have our district meetings with the police, they talk about some of those issues and concerns dealing with your department. Not just by with you, but what affects them. When you visit the 2nd District, because health and safety are directly correlated. So when you visit the 2nd District, they're in there discussing health issues. When I stopped, I was safety chair for 8 years. And 5th District, they're in there discussing health issues. But guess what? The health department is not there. They're not there. So it's correlated. These council members know. Councilman Starr, when you guys have your meetings at the 3rd District, health comes up. And when that health, because you can do prevention with health, which also cuts down on crime. Those things, it's correlated. But They never show up. You never there. Not just you, but going all the way back. I've been here for almost 25 years on city council. The health department has never been to any of those meetings. Same thing with building and housing. They should drop by. Safety and building and housing is directly correlated. When you have unsafe routes for children, open, vacant, vandalized houses, and residents come there and they discuss that because it's correlated with safety, but they're not there. That would give us an up-close view of what's going on in the district. District 1, 2, 3, 4, and 5. We could do prevention that way, but the health department, you're not there. You're not there, but you need to be there.
Through the
I'm
chair.
not saying you're not doing a
Through
good
the
job,
chair.
Director. I'm just saying that I've been here for a long time, and I know lessons learned. I'm listening.
Through the chair, we're at community meetings essentially 2-3 a week throughout the year. So we're out there. So I'll just push back a little bit on that. We're out
It's
there.
good to push back, but you're not at the safety meetings, and you should be at the safety meetings.
Through the chair, we've been to the safety meetings, so we can go more consistently, but
Okay,
just, recognizing now that we're fully staffed,
got you.
we can't use overtime the way that we could when we're understaffed. And so if I send an inspector to a meeting from 5 to 8, that means that I am saying that they shouldn't be out in the field in your wards from 9 to 12.
You know what? I drive my ward and I walk it. You walk with me. I don't know when your people, when they're going through Glenville. I don't know. I don't see a report with. This is not personal.
No, I
This is me
hear you. Through
walking
the
and
chair,
driving.
I hear you.
I
But
don't see a report.
we will continue to send the report every month.
Right, and I don't see, like even when we go after some establishments, liquor license, health and their liquor license is directly correlated. Then we could put a cloud on their liquor license because of issues and concerns. Same thing with building the housing, sir.
Through the chair, we don't regulate liquor licenses.
I know you don't
Okay.
regulate liquor license, but I'm saying if there's an issue, you could give it to that council member, and if there's an issue, you could also give it to the law department, saying that the environmentals went in here and they have food issues. The environmentals went in here and a certain store, they're dealing with vermins in that store.
Yep.
And then that would help build our case more.
Through the chair, we absolutely do that. We do that now, and we'll continue to do that. But that started in the last year, so appreciate the
started in the
feedback.
last year?
Absolutely.
Good,
Yep.
Good.
Thank you.
I'm just focusing on the issues and the
We
concerns.
hear you. But
focusing
through
on
the chair, I'm proud of this team. We're doing incredible work. And, like I said, we're fully staffed for the first time in years. So we're out there, and hopefully council folks are recognizing the difference. To the point where sometimes we're enforcing some of the laws where, council folks have asked us to step back a little bit. So we're out there. We're trying to find that balance to make this a healthier community. And we'll continue to do that and continue to work with you.
Right. Just document it and help us out, even dealing with the liquor license and those kind of things. I mean, that's important for me.
Through the chair, absolutely.
All right, thank you very much. I'm going to yield to my vice chair, and then we'll start with the lead issues. Are you staying, Director?
Yes, sir.
Okay. Council lady, let me sit over here and then you do it.
Oh, boy. I think we have the whole team. Come forward, it's your time.
Can I stop by and see? I'm gonna put my clothes, my coat and hat in my office.
Yeah, please.
All right, cool beans.
Good morning. Good morning. All right. For those following along at home, I'm excited to have this team here. This is sort of a two-part, this is the chapter 2 in a two-part lead week for this team, talking through what I think is correctly phrased in the upcoming PowerPoint as sort of a retooling, a re-engagement around the dream and the promise of the 2019 lead safe law, focusing on built environment. So as I think Emily will point out, we don't have water here at the table because we're talking about sort of lead paint today, but we do have everybody else in the different departments within the city who touches this issue. And I'm very excited to be able to have this group come before the Health and Human Services Committee to sort of explain the updates that were also given to the city's Lead Safe Advisory Board last Thursday, and continue the long tradition of council being supportive of this process. So with that, I'll hand it over to Emily Collins from the mayor's office.
Thank you so much. It's through the chair, right?
Yes, apparently, yes.
Right, to the chair, right. Thank you so much, and thank you for the context of this being the second go-around. So we did present to the Lead Safe Advisory Board on Thursday of last week with almost the same presentation. There are a couple of more contextual slides here so everyone is aware. But I am really proud to be here with this very, very strong team. My title is Senior Advisor to the Mayor. I think I'm new to a couple of you, and I've been here since October of last year, working on two major projects, one homelessness and the second lead programming. So this has been a really great time period for me to not only get to know this team, but also understand our initial approach to lead safe programming. And I'm very proud of Cleveland when I look at some of the numbers, to be honest with you. This is a young regulatory program led by a strong team of leaders who are here at the table today. So what we're going to do is go through some slides that touch on kind of an overarching where are we and where would we like to go introduction, and then I'll hand it over to each department so that they can go over where they are and where they're going for lead safe programming. And I think what you'll find as we go through this is that there are very similar themes. So we're looking forward to the discussion today. Let me figure this out. I think I can do it. Maybe not. There we go. Okay. All right. It's a first. So what I'd like to do is talk about where we are right now, our initial approach. And the initial approach is one where each department has its own model of addressing lead paint in the environment. That's obviously focused on regulatory programs, repair programs, and incentive programs. And I think that we're at a point where we're able to reflect on what's happened in a way that allows us to understand where we could potentially go. For the certificate program in building and housing, this is related to landlords. It's a command and control model. So it's almost a traditional regulatory model for environmental pollutants, where we are requiring that people obtain authorization to move forward with their rental as lead safe. It's very technical, so it's not something that I would understand a water supply industrial guru to understand as well as, say, a landlord. But it's just the same. It's as technical as traditional environmental programs. We rely on the private sector to address some of the problems that are apparent in buildings before they're authorized to continue their business operations. And our goal, obviously, is overall compliance. And I think that's worth noting, that our goal is overall compliance, because while that's going to remain true, it's also something that I think has kept us from looking at some of the midstream metrics that I think can be helpful for adjustment. For public health, the model is one, as we have started, of secondary prevention, right? So it's not that we are going house to house and asking for for blood, right, to understand if people are in compliance. Instead, we know that when they're, when they're tested at their pediatrician, we are alerted if there's a problem, and that's when we take action. So it is a secondary prevention model. For community development, the repair work that they're doing is very much income eligible work. Federal dollars are often used here. And I'll let Assistant Director Scott go into more detail. But we also have home repair dollars, obviously, where lead is part of the programming there. It's applicable to not just landlords, but owners and tenants as well. So much broader coverage. Similar themes that we're experiencing there of some difficulty and delays. Assistant Director Scott will talk about Glenville as well today. And then we're incentivizing things. We're incentivizing things ourselves, but we're also incentivizing things through our ARPA dollars. And the Lead Safe Coalition has a lot of various programming on incentives that we can talk through. And Gina is here, our ARPA program manager, to speak to the reporting on that. So the results from these initial models, I think we've heard some of the narrative around this, and we have some data from our Lead Safe auditor, but the themes are similar. There is a bit of a stall, right? For building and housing, the Lead Safe Certificate Program, we're experiencing spikes as we announce new things, as we announce enforcement, as we announce residents first. We get compliance spikes, but we're also experiencing at the same time lags in renewals. And with a 2-year turnaround, that's really problematic. So we are very aware of that. We also have very low compliance rates for the 1 to 3 unit landlord, which is the small landlord. And for a technical program, you can imagine why that might be. For public health, the numbers are fairly steady, and I'll let Dr. Margolius go into that in some detail. But even with strong enforcement and successful litigation, we're seeing similar numbers. So not huge change with the initial approach. For community development, we're going to hear a lot about the backlogs, contractor issues. I think you all are familiar with some of these themes. And I will say for our ARPA funds, we're starting to see one of the categories exceed expectations, which is incentives. So I think we are at a point where we can acknowledge, that we can push things forward in different ways and use all of the potential tools available to us. We know that we can use tools such as Residents First to really think through and incentivize work with a 1 to 3 unit landlord, with a small landlord compliance unit. I think I called it center here, but I think we're going to be calling it unit. It's important to me that we are consistently empowering our city teams. This is really, really hard work for an initial regulatory program. I think we all know, the Clean Water Act, for example, is seeing major success now, and it's been at least 50 years, right? So I don't mean to say that we are planning long compliance dates, but what we are planning for is to consistently be able to retool as we are noticing different metrics midstream, so that we can get to the point of compliance. So we'll talk about how we can engage in better ways, how we can really incorporate the point of view of the regulated public, and we have done that. As of on Thursday, we released a request for public comment on Lead Safe certification guidance. So we want to project that we are opening the door to feedback and really interested in making sure that users are taken into account of our systems, whether it's in person or whether it is, actual engagement with the 1 to 3 unit landlord to make sure that they are able to use what's available to them to get to the point of safety. And then I think, so one more version of how we can use some of our outreach and engagement tools to get to the point of that ultimate goal of compliance. And feedback loops is going to be important in that. So with that, I'm going to hand it over to Director Martin O'Toole, who's going to talk you through building and housing and the certificate program.
Thank you. Madam Chair, good morning. Esteemed committee members, it's good to be here. Okay, it's going to be wonky, isn't it? It's not going to want to, there we go. All right, so this is, nope, now it's going too fast, isn't it? My goodness. It's in a Monday sort of mood today. There we go. Okay. So I want to take you through a snapshot of where we are now. So since we've been enforcing this, how many current 2-year certificates and 20-year exemptions, et cetera, that we've got. So I think while we feel this is underwhelming for our expectation of having 100% compliance by 2028, I think it shows steady gains. So we have 4,756 2-year current certificates. We have 1,871 expired. Now that's one of the concerning figures because we need these people to re-up. But we are seeing an uptick in 20-year exemptions, which we think is a very positive trend, and we're hoping that with some of the new incentives coming out, we'll get more people to that standard, which is what our goal is. So 2-year units, 15,300. 20-year, we have 3,038.22. So that's quite a few that meet the 20-year standard. So again, total rental registry units, 94,862, and that's the amount that we believe exist. So what are we doing now, and how is this going? So, one of the things we're going to talk about a little bit later is the 1 to 3 family-led compliance unit, which we think is going to be a game changer. We also, Emily spoke of, she worked very hard on a guidance document that's out for public comment. We think this is also going to eliminate some confusion with lead risk assessors, and also, helping to get people to all the various incentive programs that we believe will be game-changing. So the next slide is from our compliance auditor from CASE. And I think it's important to look objectively at how we're doing against our peers. And so we typically use Rhode Island, which is Providence, Detroit, and Rochester. They've had programs for longer than we have. And when we look at the trends, and we look only at registered rentals, not at the full expected amount of rental properties that aren't in our registry, you can see that we actually are surpassing our peer cities. That's cold comfort to us because obviously we want to do better than that. We want 100% compliance in 2028, which was the goal of this program. But I think it bears a reminder that given the difficulty of this task and the age of our housing stock, we certainly see that we've made tremendous progress and in fact exceeding that of our peers. But again, we need to pick up the pace here. So one of the bright spots is that we did get a $4.9 million direct award to the city from the state of Ohio, from LeadSafe Ohio funding, which we intend to start deploying in Q2 of 2024, so just around the corner. And we're envisioning this to be a window and door incentive program open to landlords, which will be administered by CHN Housing Partners, which we hope will help close some of the funding gaps from other programs that are out there and help push units closer to a 20-year compliance standard. Okay, So what are some of the big challenges out there to lead-safe enforcement? Well, what we're seeing is an increasing number of reports that get submitted that are rejected, which suggests a potential flaw in the program, the need for additional training for lead workers, and the need for clear guidance and standardized reporting protocols, which is what we're tackling here with our new guidance document. So we have 611 failed reports since the program began. And many of these, are missing incomplete information. Some of them have failing samples, which still get submitted to us. There are numerous reasons, not using an XRF gun appropriately. But really, when we look at this, our overarching concern is the lead clearance exams conducted without a risk assessment, we don't believe are a reflection necessarily on general lead safety. So a lead risk assessment is needed to identify concerns that need to be addressed before a clearance exam occurs. And this is a fundamental thinking on this that may require us to make some major changes in how we're doing this program. And then, of course, what we measure our success by is, are we actually reducing lead poisoning in children? So we, with the lead auditor, are studying this going forward very, very acutely, because that's really measures our success. So the 1 to 3 family lead compliance unit is a concept that our lead unit has come to after working for several years with the population and learning that the least amount of compliance is coming through 1 to 3 family units. Many of these are disinvested. They're over 100 years old. In some cases, small landlords really lack resources to make the full repairs needed to get their property to a lead-safe condition. Bless you. So the plan here is to set up, and we've posted a chief for a 1 to 3 family lead compliance unit. We now have about 27 employees within building and housing who are certified lead risk assessors, and we continue to train more. We want all of our staff to be certified lead risk assessors. We intend to do proactive outreach to non-compliant 1 to 3 family rental properties, continuing our presence at community events, and then doing an earned media and website push to get people to sign up for the program. So carrots versus sticks. What will this do for a 1 to 3 family owner of a rental property? It'll stall prosecution. So you work with us, you're making progress, you're getting to that standard. We're not going to throw the book at you while you're working towards your goal. We will work with you. You'll get a free lead risk assessment from one of our staff that's on the team. And then linked to resources. So there's some confusion out there. There's pots of money in different places, and how do you apply? And just adding some transparency to that process is really the goal here. So the reality of it is only 12% of single-family rentals and 9% of two-family rentals have obtained lead-safe compliance, compared to 44% compliance for 10-unit buildings and above. That's pretty startling. So obviously, we intend to take a hand-holding approach to this by providing that lead risk assessment as part of a rental healthy home inspection process, keeping people out of prosecution who are actively working toward the goal of lead-safe compliance, and then providing assistance. There's confusion about the different pots of money and how to get at them. And certainly, getting them ready to hand off to a clearance exam third-party individual who can then handle their clearance and get the certificate. So Residents First is a game changer for lead-safe, we believe. So we will begin utilizing civil tickets in May of 2024 to deal with noncompliance issues. We have a new Acela lead app in development, which will launch in Q2 of 2024. And the city's open data portal, which I know you've all heard so much about, we're very excited about with Urban AI, is going to go live in Q2 and also allow for easier public access to lead safe in all building and housing information. So public guidance has been requested for our new lead-safe guidelines, and we're soliciting that feedback and intend to get it back. I think it's April. Yes, there's a typo on the slide. So it's April 26th. April 26th. So mark your calendars and make sure you send us guidance, public comment on this guidance. We've been getting it. So we put this out last Thursday, and we've gotten quite a bit of it already. And we intend, hopefully to review that and make some tweaks to what we're proposing here. So I'm going to hand it off to Dr. Margolius.
Thank you, Director. Let's see how I do. All right, great. As Emily described, the role of the Cleveland Department of Public Health in this space is secondary prevention. So the children and families who are affected by lead poisoning, those results are drawn by their pediatricians. They're sent down to the Ohio Department of Health. The Ohio Department of Health sends us back a list of the families affected by lead poisoning, and then our team does outreach, or if they're at the higher level, goes out and does an investigation. This is one of our billboards that you've seen out in Cleveland. Hopefully you've all seen that. Anybody? Yeah, I got some nods. All right. All right. All right. Well, we'll have to work on getting some over in Ward 9, but I think they're out there. And as I mentioned earlier, our team takes a big part in community outreach and doing different events so that folks are always thinking about the risk for lead poisoning. And this is the why. So in 2023, 316 cases, children with a lead poisoning level of greater than 10 micrograms per deciliter were referred to the Department of Public Health. That warrants further investigation from our team, and this is a photograph from one of our health inspectors that was published in Signal Cleveland from the series by Candace Wilder last year about the Wheeler family, of a box of toys that's covered in dust, and that dust is unfortunately lead dust. This past year, Ohio Department of Health lowered the level for when cases are referred to us for outreach from 5 micrograms per deciliter to 3.5 micrograms per deciliter. And so now our team gets an additional 1,359 cases in 2023 of children affected by lead poisoning in between this 3.5 to 9.9 level. And that results in our team doing phone and mail outreach to talk about some measures to help prevent further lead poisoning. This is my favorite picture from my work so far with the health department. As you can see, that's from our lead walk in 2022 with the whole team, including some of our younger health inspectors before we were fully staffed. Thank you for laughing. And this is my second favorite picture. So this is something that we've gotten more aggressive about in the past year and a half, where we've partnered with the law department to do a couple things. Number one, we're prosecuting property owners who have not complied, particularly focused on those LLCs without local agents in control, local agents in charge. And then the other part is that we have put affidavits on all of the titles for properties that have poisoned children with lead. So in the past, you could sell your property and maybe hide the fact that your property has poisoned children with lead, but now there's an affidavit on that property, and partnering with the county, 658 properties have this affidavit on their titles. And as a result of this, 36 property owners have called our department to say, whoa, we what can we do to, you're really hurting our business here. And so they've gone through the process of abatement and we've gotten 36 releases from those affidavits. And then we've had 163 lead hazard control orders that have been closed for compliance. So our goal with this work in the health department is compliance to help property owners and families through this process to get their property through abatement. As you can see, that number is not as high as it should be. Thank you. And now I'll turn it over to community development.
My name is Gina Ventry, and I'm administering the $13 million ARPA Treasury Award to the Mount Sinai Enterprise Lead Safe Cleveland Coalition. The award opened in July 1st of 2022, and it's set to close with a lot of other federally restricted ARPA programs in 2026, by the end of 2026 for sure. The services covered under this program are grants for property owners for lead-safe home repair, lead-safe certification incentives, emergency housing assistance for households facing insecurities due to lead, workforce development, and screening and testing. Here we have an overview of the successes and challenges of this program. Starting with the successes, the incentives are performing very well at over 100% of expected and counting, and they're well above performance goals and spending sooner than anticipated. Part of the reason cited by the coalition is that the private market is driving folks towards the incentive program. The coalition has done a good job of remaining nimble to changes. They're working to address complaints regarding the time it takes to get the incentives out. Environmental Health Watch is working hard to get these incentives out in a 90-day time frame. The coalition also has contracts executed for the repair grants administrators. They've increased staff capacity, and they're ramping up to bring these programs online so that when their central intake system is finalized and ready to go live, everything is ready to go to get these homes repaired. They have a number of homes in the pipeline, and these repairs should be moving along fairly soon. They're using a fixed price, streamlined process for contractors so that the process can move along more efficiently, and they anticipate that these grants will start moving in April, and they're very confident that they can meet their milestones in this area, which is approximately 583 homes repaired by the end of the program period. As for the challenges of the program, first of all, they had a long contracting process that delayed the program start and delayed milestones in the program. So as a result, they're in the position of playing a little bit of catch up in most programming areas, except for incentives, which, as I've said, are performing very, very well. We're also up against federally restricted ARPA deadlines. So when we're thinking about federally restricted ARPA, we're thinking about time. Funds have to be fully obligated by the end of 2024 and spent by the end of 2026. Any funds not obligated or spent go straight back to the federal government. The city will not get a second bite at those. So we've been working internally with the mayor's office and the finance department to come up with a strategy to address these deadlines and ensure that programs funded by federally restricted ARPA are on track to be successful and spend down their funds by 2026. So all federally restricted programs across the city will be undergoing a review process with an eye towards addressing any performance issues, including this program. Okay. This is just to highlight the success of the lead safe certification incentives. As you can see, 2,531 by the end of 2023, and they're expecting 450 by the end of the first quarter of 2024. This is an overview of the milestone performance to date. A few things to highlight here. The home repair grants, they have a number of homes in the pipeline, and they're ready to go, and they anticipate these moving sometime in April. And you can see the incentives, how well they're performing here on that highlighted line. Here is the budget status as of our first quarter check-in. They've spent about $2.3 million, approximately 36% of the funds so far. So considering the performance to date, what opportunities do we have? The certification incentives are performing very well. However, other indicators of success are not necessarily demonstrated in the specific metrics measured in this funded program. So given this data, where do we go from here? Also keeping in mind that we're on a tight deadline for programmatic decisions for federally restricted ARPA programs, and the city is aiming to make these decisions and have the data to them by June 2024. So we're in the process of assessing program performance and considering necessary changes so that this program can be successful and so that the city's investment stays invested in the city. We have a number of options here, the first being a wait-and-see approach. A few programs are coming online in the next few months that, including Lead Safe Ohio and Residents First, and the coalition anticipates these programs will drive customers towards their programming. Also, a number of general fund home repair programs are scheduled to come online in the next few months, with provisions in the agreements that the agencies carrying out these programs connect residents with city and coalition lead safe programming. We're also considering the information that we do have, what sorts of adjustments can we make within the program itself, adjusting the budget and milestones to fund what's working. The coalition has expressed confidence in their home repair grants, screening and testing, and workforce development areas of the program. And one thing we're considering is directing more funds towards incentives and lead-safe home repair grants. Also thinking about raising the $12,000 grants cap on home repair grants.
That's a good thing.
As for the relocation assistance portion, they're awaiting responses to their RFP. These responses can be a great indicator of the direction for that service area of this program, so we're willing to wait on those to come back. So that is an overview, a snapshot in time of where we are with this ARPA Mount Sinai Enterprise Lead Safe program.
Good morning, everyone.
Good morning, Commissioner. Welcome aboard.
To the chair, to the councilman, please stop putting me back in that commissioner role. I still have not suffered, I've not gotten past my PTSD from that. So,
You know, I used to see you there.
yes, sir. Yes, sir.
Assistant Director. Assistant Director. You're right.
It's a pleasure to be here before you all and have an opportunity to be able to point to the successes, but also the challenges, and more importantly, the progress that we're making as it pertains to lead hazard control grants. So it's right there. You have the slides. I'm not going to read it to you verbatim. But in short, what this program is, we have two grants, a citywide grant and a Glenville grant that are working to identify homes throughout the city of Cleveland that we inspect once the party is eligible, determine if there are lead hazards in the home, either through the interior or the exterior. Eligibility requirements. Home obviously has to be in the city of Cleveland, built before 1978. There's a child under the age of 6 living or visiting the home 20 plus hours a week, or a pregnant woman living in the home. The lead hazards, again, must be identified. The family does have to meet income criteria, and there needs to be property taxes are current or on an approved payment plan. So an application is received. Team, let me advance the slide. Too far down.
Might need us to.
Yep, thank you. So application is received, either it comes into us directly through our intake team or through the community engagement specialists that are in various, I believe it's 12 CDCs throughout the city of Cleveland. One of our intake team works with the applicant to determine, or excuse me, to acquire the necessary documents to determine eligibility. If eligible, then a CD inspector will go out and perform a LIRA, which is a lead inspection risk assessment, interior and exterior. And this helps determine the scope of the work that needs to be performed. The specification, the contract specifications are prepared, given to an assigned contractor to schedule the job. Once started, the interior jobs can take up to 10 days. Exterior may take longer based on the weather, and the family is given a relocation allowance while the interior work is being done. Once completed, CD inspector will inspect the job, ensure that it's cleared, provide the clearances, and notices to building and housing and public health if there was an applicable control order on the property. Next slide, please. There we go.
Thank you.
I didn't realize that was touchscreen. That's pretty cool. You guys have all the new toys here. So what you see is a snapshot of where we are on both grants, citywide and Glenville. The top number you see on both is the jobs completed in 2023, 30 citywide, 8 Glenville. The next number is the amount of jobs completed thus far in the year, 4 citywide, unfortunately none completed yet on a Glenville grant. There's 92 applications on hand for citywide, 67 for Glenville. Now, just to take a moment to, it's all condensed into one, just appreciate that that's what's in the pipeline. But that's whether it's, we're processing the intake, meaning the initial application. We're in the process of updating documents or acquiring documents, ERs, environmental reviews. I'll go into that a little bit more deeply in a moment. Contractor assignment, or it's waiting to be assigned to a contractor. So again, 92 citywide, 67 in Glenville. Citywide, 1 job is under construction, and under Glenville, 2 jobs are pending start dates. So what are some of our challenges? We all hear about staffing, so that is a challenge, but there actually is something positive about that, and I'll go into that on the next slide because we're making some great progress on most of our staffing. Contractor shortage, again, you're aware of that. Backlog and environmental reviews. So environmental reviews are briefly, if you're getting any kind of HUD funding, you have to make sure that you assess the project to get a determination on how it may impact the environment and its compliance with with local, state, and federal rules. So, and then finally, technology. We have a system that we utilize called Neighborly that has unfortunately not been what we thought it would be. So we've been trying to navigate the challenges both internally and externally with the CDCs. I know it's something I believe you all use it as well. Well, no, you're not using it for land bank, so never mind. Skip that. So yeah, I'll get into that. Next slide, please. I'll get into all of those challenges on the next slide and how we're addressing them. Thank you, sir. So these are various things that are in levels of progress. Fixed pricing versus bidding, we already went to that. So instead of having to have the contractors bid, there's a menu so that they have a clear appreciation of what the job would entail and what each specification would provide as far as pricing for them. Increased recruitment of contractors. We've been going out, outreach. We're going to the various trade shows. We're actually communicating with the CDCs to the extent that the CDCs have their own contractors. We're identifying who they have to try and bring them into our pool. Posting on social media, what you see is a draft of a flyer that our community engagement manager, Brett Parsons, is working on so that we can start getting it on social media and out to the CDCs, to your respective offices and partners. There was also a pollution insurance that where instead of making every contractor get this up front, which has a premium of almost $2,500 for it just even start before you even get work. Our jobs don't typically require the level of insurance that will be needed. So instead of it being carte blanche for every contractor we're working with, it's assessed on a case-by-case basis. But we don't anticipate that they'll be needing it for the jobs that we assign. Implementation vendor, I'll save that for last. The environmental reviews, we're outsourcing them to the consultant that we already have, and we're increasing staff's capacity to do them and improving the training so that way they're getting the documentation to the compliance department to review in a more effective and more comprehensive manner. I'm even learning how to do them so that way I can knock a few out a week myself. Lower level threshold But nonetheless, whatever it takes for the team to jump in and try and move them along. Increased staffing. So the bureau chief position closed last week. I was reviewing job applications and sent out supplemental questions to the first tier, if you would, last week. We also don't have a chief in construction management. Assistant Chief John Stone has been filling in that gap for some period. But as soon as the bureau chief is brought in and onboarded, we'll make sure that we have a chief application, or we'll be receiving application. Intake staff, we've made 3 offers. They've all accepted, so that's going through right now. And the CESs, that's the community engagement specialists. You recognize them right now as being in the CDCs. We actually are extending that to have 5 in-house. So there'll be 1 that'll serve as an assistant manager and the other 4 so that way they can be dispersed, 2 roving on the east side, 2 on the west side, to have a bigger presence at community events, councilmatic events, and assist with the application process, running down documents with the citizens. So very much more of a case manager, not just sitting sedentary, but really out there in the community working with the citizens to navigate our work. The negative piece, though, is we've not had any more success on the inspectors, which is challenging. The salary just isn't competitive. That's what we're being told. The last time we posted, we had 39 applications. Only 4 were qualified. We extended offers to 2. One of the four we didn't go forward with. We would have gone forward with another, but we believe that person might have been leveraging us. So we understand how that happens. The other 2 extended offers and the salary just wasn't attractive to them. So that part is a challenge. To exacerbate that challenge, we only had 1 inspector dedicated to lead after our previous inspector retired. So we've had to reallocate that work to other inspector staff. Of the 7 inspectors that we have, 1 being Assistant Chief John Stone, 4 of them do have their lead risk assessor license. So some of those cases are going to be redistributed to them to help move the ball on closing them. Simplify the lead application. It's cumbersome. We're trying to demystify it, if you would, so that way the challenges that the citizens have can be reduced, but we can still do what we need to do to be in compliance with HUD on the front end. We're looking to replace Neighborly, working with ITS on a system, on an RFP, for a new vendor, for a new system that's much more comprehensive for everything that we're trying to do in community development, not piecemeal. But in the interim, I have to give a shout out to Assistant Director Wackers. He's really been using the existing Power BI technology under Microsoft to be able to create systems internally that we can use that speaks more effectively and gives us the result and the reporting that we need to be effectively tracking our progress. And going back in conclusion, the implementation vendor RFP. So we put an RFP out in January for implementation vendor. In short, that's a construction manager. So it would be an entity who's responsible for going on site. Once we determine eligibility, they go on site, they have the conferences with the inspectors, our inspectors, as well as the citizen. They determine the scope of the work that needs to be performed. They are the ones that will be attracting the contractors to them. They are the one that will be paying the contractors incrementally. So whereas right now, contractors only get paid at the conclusion, and that's part of the lack of appeal, this RFP will have 3 payment points during the progress of a job. So starting, I believe, 80%, and then at the conclusion. And then our inspectors, instead of having to do a lot of this work, will be able to just inspect the progress, monitor the progress, close the permits. So before we go back out to identify, trying to go through the hiring process of more inspectors, we want this position to be put in place and see how that's working effectively before we go back out to the market and find, again, the wage is not competitive. So those are the things that are in various levels of progress now, so that way we can move our lead grants more effectively. And again, the construction overall, home repair, home rehabilitation, as well as lead. So, thank you.
That was good.
Absolutely. I think that concludes the presentations from the administration. It's Monday morning. I'm sensing the Monday morning kind of, we're easing into the week. And so I want to open up the conversation by emphasizing how big of a deal some of this discussion is, and just thanking everyone for their time for putting this in. If you kind of walk away with a neon sign, above your head, if you get one takeaway from this, I think that this idea of the 1 to 3 unit lead compliance program, this is something we haven't had in place before. That is so important. The other neon sign, I think, is so much of what you guys are doing in community development to make sure that the dollars that have been promised to this program are being felt in the streets. That they're not just sitting there in a bank account, they're getting out into our properties. So I really want to thank everybody for the engagement and really identifying, I think, as you often say, Chairman, the SWOT analysis, the strengths, weaknesses, opportunities, and threats. So that is... And trends, yeah, that is particularly helpful. So I have had a couple bites at the apple here, both from my conversations and with the Lead Safe Advisory Board. I want to open it up first to my colleagues. I see Councilman Starr is up first.
Thank you, Chairwoman. One of the things that oftentimes confuses me with the lead initiative is, you can go into a property and notice that they have lead in there, and you may sometimes get an understanding that the children in that property maybe have high levels of lead. But then when you face the reality, the home has a lot of home repairs. Now, I know back in August 21st, 2023, around that time period, we passed a $15 million grant for home repairs in a program to help address vacancies and the blight. One of the issues I have is, where are we at with getting those dollars out? Because, like I mentioned to, obviously, the mayor during budgeting, we pass ordinances and we get things out, and then we see stuff that passed later after that, and then that ordinance or that piece of legislation and that funding hasn't got out yet, but something else just passed and got out quicker. So my question is, when it relates to this $15 million of ARPA funding that we have for home repairs and other programs to address the vacancy blight, we also received $2.5 million from Key Bank, which equates to about $17.5 million. What's the holdup on that process, and how come that money hasn't gotten out yet to be able to address these homes? Because if you go into a home and you see the lead, and then you start saying, hey, this is an issue, you got to understand people got roofing issues. They got porch issues, holes in the wall, windows. They got a lot of other issues. So the lead is major, but they also got these other things that need to be tangible. So from our lens and from the work that we've done on this body, my question through the chair is, what process are we in as getting this 15 and that $2.5 million out as far as home repair process, through the chair?
Through the chair to the councilman, we are in the process of finalizing a number of these contracts this week. We are on an accelerated timeline where we're meeting in person with these agencies, bringing them to City Hall to finalize. We have 4 at last count that are in the finalization or signature stage, and a few others that are very, very close. We understand the urgency of getting these programs operating and out on the street and getting that money out the door, and we're working very diligently to do this.
So through the chair, when you say 4 agencies, what kind of agencies are these for? Because sometimes we get with agencies that just got a name recognition, and they do a horrible job with getting the dollars into those who need it most. I'm big on just standing on business. A lot of these agencies possibly say they've been doing the work, but it's residents who don't. It's other agencies who give loans for home repairs in certain areas, but they don't touch Ward 5. So I'm thinking about the residents in my neighborhood who continuously been calling my office since August. Ms. Deo, for one, on 63rd and Quincy, she's been looking for home repair. But then we look at it, this ARPA dollars was a one-time investment to really make some impactful changes that our residents can touch. And then, as you know, the next question I get from a person is this eligibility based on income. So my question to the chair, within this process, have we really revamped the income eligibility guidelines when you start talking about these home repairs? So it was a two-part question from that implementation of, are you eligible based on this amount of money? Because sometimes our guidelines is based on the economy that we no longer have no more when things are more expensive. And even if somebody making some half decent money or livable wages, they really don't have the money to put these type of repairs. So through this ARPA request, what type of updates or modernization have we done within our this process that you're explaining to the chair?
Through the chair to the councilman, the eligibility differs by agency. So for example, we have Habitat, we have Cleveland Housing Network, we have Cleveland Housing Solutions, we have LISC, and Cleveland Restoration Society. Each of these agencies' programs have their own eligibility and intake processes, which we have taken into account in the contracting process. There are both citywide home repair programs and home repair programs focused on the microgeographies on the southeast side. So giving residents plenty of opportunities to apply and be taken care of by these programs. The agencies have also addressed eligibility by having either straightforward grants, hybrid grant and loan, or a very low interest loan product coming with these home repair programs.
And and also for just making sure I have clarification. So through the chair, do we have an expected date? Because I know you named 4 agencies, so I'm assuming that those are the 4 agencies that we're looking to go through for the $17 million. I know the Key Bank was automatically, I think, through the program, it was already directed to go to Cleveland Habitat for Humanity, and I think it was like something from $250,000 and some other different things, 1.2 million or something, as far as some of the repairs. So with these 4 agencies in place and with their eligibility guidelines, do we have a list of what that looks like, or are we still figuring that out?
I can get that list to you. These programs are well along in the contracting process, with many of them near finalization and signature with the city, so I can get that list to you.
All right, and through the chair, what is the contracting process for something like this? Because, you know, like I said, it's August, and when we pass ordinance and then the media writes everything, city council did X, Y, Z in the third, next you know, all of us get all these calls about home repairs, and residents like, well, when is these home repairs going to be out? And I, like I said, I mentioned Ms. Deo, because she calls me. Not just the office, she calls my cell phone, and we have real open conversation. I said, well, the city is still working through the application and the process, and one of the biggest things that she's experienced is becoming a homeowner 20-something years ago. Then at that time, you probably had kids in your household. Now those kids are adults, and now on your income, you don't have that surplus of cash to match anything. So therefore, if you middle class or having a little bit of money, they saying you're not eligible for these dollars. So I'm nervous for residents in that situation, because nowadays in city of Cleveland, it's like you got to be dirt poor to get any assistance from your city. And I think that is just the worst thing ever, because we setting everyone back. If I'm making some progress and I just need some little help to get me over the boat, I should be able to receive that help instead of me having to be dirt poor in order to receive these services. So I know, Chairwoman, I'm possibly running up on time, but I just want us to understand that home repair as soon as possible with these 4 agencies. And I know you mentioned you're going to send over through the chair the guidelines and eligibilities that each organization have. And then also, is there anything, once we look at it, if there's some things that, is it any flexibility to amend some of those guidelines if is not modernized for these type of issues, or those guidelines are set in stone based on these 4 agencies through the chair?
Through the chair to the councilman, I think the agencies have basically set their guidelines, and we've, I think, done a good job of letting them do what they do well and getting their programs up and running. I will say that I believe they will be open to some flexibility in these guidelines as well.
Thank you, and just to our staff and chair, those guidelines, I know, Drain Team, she got me. Just send those over to our staff so we all can look at it, and I yield, Chair.
Thank you, Councilman. I appreciate it. I know we're all following along with the distribution of those critical ARPA funds as well. I'm going to hand it over to the real chair of HHS, Councilman Conwell.
Thank you very much. I'm looking at your compliance trend, and I like that. And this, who put this together, the trend? Was that you, Director?
That was our lead safe auditor at Case Western.
At Case Western? Mm-hmm. This is important. So I think I'm reading it right. I mean, I like looking at
You know,
graphs.
we have the clicker to get back to the slide. Thanks. Go back.
Now, he put this together when, he or she put this compliance trend together when?
So the lead safe auditor continually monitors the city's progress toward lead safe certificate compliance.
They evaluated.
Yes, he was hired as part of the ordinance. We had to have a third-party auditor to measure how we're doing. So he continually updates the information. So this is our latest update we got from him. So essentially showing our compliance versus the peer group that we've been following.
So you're comparing and contrasting it. What he's saying is that we need to hit 2,700 per quarter to stay in with our goals
Our goal of 100% compliance by 2028.
by 2028.
Yes, that's our goal.
And so I think we're behind by how many? He didn't quantify that.
Well, so what he's saying is, you know, that if we don't get 2,700 new applications in a quarter, we're falling further behind. So we have to push more applications coming in.
So where are we at right now? He hasn't narrated that, Director.
He has narrated that in his auditor report, which I can forward to you. There's a
Okay.
lot of slides. There's many, many slides. So I certainly will send you his deck so that you can look it over. But basically, we started to see applications start to slide down to under 400 coming in, you know, which is not what we need. We need 2,700. But with Residents First passing, we feel like now we're going to start to see, and we have seen more of an uptick. And I do have Karen Detmer here if we want to ask specific questions about what she sees coming in every day.
Who is Karen?
Karen is the manager of lead initiatives.
Let me ask her a question,
Yes,
Director.
she can certainly come up. And I want to go on the record as saying she baked cookies today.
Yeah, it was good. I was over there.
Okay, we have a coffee cake and some cookies.
So, looking at this, Karen, the 2,700, let's quantify, how many numbers are we behind?
Well, if we look at the trend of what the auditor is reporting, he takes all of our data that we have in Acela and assesses how many new certificates we have, how many new people have applied for a certificate, how many have been renewed. So it starts to kind of blend a little together because the total number includes those ones who re-upped their certificate. But we, according to him and according to our Acela records, we are significantly behind by, you know, a couple thousand because we're missing 2,700 each quarter. Start adding that up. And that was supposed to be from the beginning. You know, we come up with how many do we need each quarter to be able to get to 100%. So it started out pretty good, and the highest quarter was about 1,000. But we've never hit that high number. Which is why we're concentrating right now and will continue to move forward on really trying to address the public, especially these 1 to 3 families. We need to start getting some numbers, and we need to get these smaller rental properties, because I think Dr. Margolius will even attest to, these are where the kids, most of the kids are getting poisoned too in these smaller homes. We're not in these 200-unit complexes doing inspections all the time. We're in these 1 to 3 families doing lead inspections and trying to get them into it. So hopefully this push will really, within the next, couple quarters, I really anticipate seeing a huge uptick.
Yeah, you're gonna have to crash it to get there. You do a project, and if you're behind, you gotta crash the project to get to where you're at. If you monitor and control it, and you're behind. You know what? Here's another thing. Sometimes you might have the numbers. Let's say the numbers might say you need to be at 2,700, but you only did 1,000. But the outcome measures they're what you're looking for at the 1,000. You see what I'm saying? Because you're hitting your objectives of doing prevention.
Right.
You're hitting your objectives of being in the homes. Sometimes you may have a lot of applications, but you're not executing on the applications. So sometimes the numbers can be, you just have to look at it. You have to create a scorecard to look at it to see where you're at.
And I think you'll see from the guidance document that we're really trying to emphasize what's important about the program and what we need those independent inspectors to do, as well as the landlords and the tenants. We need them to recognize that if their property is not ready to be lead certified, that they get the help and assistance that they need to get there. Because if you think of our, housing stock, there's not that many you can walk in and get a passing lead safe certificate to. They're older homes. The turnover from rentals and it's just, they need a lot. And I've always said, education is just key. We need to really, and we plan on pushing that out. And the guidance document, we're going to do webinars for all the inspectors to walk through that guidance document once again and really emphasize this is what you need to do to get a lead safe certificate to these people in these homes.
So, to hit the numbers, you guys have built relationships with your key stakeholders. You have that coalition and other key stakeholders that's in all of our neighborhoods. Like the schools. Are the schools, they letting you talk with them, anything like that? Doctor?
Through the chair, yes.
Okay, so you had the relationships with them. And what other key stakeholders you think that we might need to talk with, like community centers, recreation centers? I mean, we have some places that's key. Doctor, what you think?
Through the chair, absolutely.
Okay.
To the chair, also, in addition to the stakeholders you've mentioned, I think we really need to talk directly to landlords, directly to, so the stakeholders can be tenants in some instances. The stakeholders can also be the risk assessors and clearance technicians who are actual users of our system. So I think you're exactly right. We do need to push the number of applications, upward, but we also need to push the quality of application we're receiving, and that's part of what we're trying to. Yeah. So we're taking stock of the moment we're in to make sure that we're ensuring effectiveness as we're trying to get that upward trajectory of applications as well.
So let me ask you this other question, barriers. You guys, you didn't put down barriers, but you did narrate some barriers. You talked about staffing, you talked about the average wage, you discussed that in barriers, but barriers with the landlords.
Yes, our barriers aren't related to, our barriers are more related to the properties themselves. So, one of the things that we notice is that the 1 to 3 family, as stated previously, they're just not able to comply. Their properties are too disinvested. They can't just get a clearance exam. They've got too far to go. They need to replace major components of the property, the windows, the doors, the porch boards. they need to do significant work that many of them don't have the money to do. And so that was the impetus for us establishing the 1 to 3 family-led compliance unit, which, you know, should help us get there. It provides more of a carrot than a stick approach for these smaller landlords so that we have a lead risk assessor going out to the property from building and housing, letting them know what needs to be done, kind of holding their hand and helping them get access to the programs that they need to get to the finish line, to get their clearance exam, and to get their lead safe certification. The $4.9 million we got from the state of Ohio, which we're launching as a window and door program, should also help. So that can be combined with some of these other pots of funding to get people closer to a 20-year lead compliance standard, which in our way of thinking is the way we want everybody to go, right? A 2-year interim control standard is temporary. It's like a Band-Aid. The minute you start opening windows and doors and paint flakes again, you're back where you started, versus you replace those major components that typically cause the poisoning. You make sure you don't have bare dirt outside. You do all of the things, and then you've got a really safe house, and that's our goal. Get people there.
You know what's hurting in the long run, what's hurting is that some of the horror stories that we hear as council members in our community meetings. For example, I'm not going to say her whole name. Pat reached out to me, and she reached out to my wife. And what she narrated at the community meetings is that how when we came in with the lead to deal with her house, they evacuated everyone. And for almost a whole year, she said her house was in shambles. And she reached out and she called. And she's called and she called. And no one returned her phone calls. And I had to go up to talk with the person in charge of it. And so when they narrate that to everyone else in the community meetings, and then when you guys reach out to them, by word of mouth, they hear these horror stories. So we're fighting against ourselves. They have to hear success in outcome measures. Not only Pat, a lady named Ms. Crowder on East 112th Street was narrating to me. She stopped me several times. I reached out to the lead department. They said they were going to execute on it. And to this day, almost 2 years later, they have not executed on her project. And that's dealing with the contractors. And even the third person, when I walked the neighborhood, she stopped me, Miss Taylor. That's Councilman Starr's cousin. Negative, talking about you guys negatively, talking with me, talking with Councilmember Starr. And you know I'm telling you, I'm being very candid, right? Yeah. So then when you reach out, you say, well, why aren't they reaching back out to me? Because of the stories they're telling about the contractors, the stories they're telling in the community meetings about not only the contractors, people are not returning their phone calls. A simple phone call, just letting people know where you're at, is cool beans. And they're not even getting their phone calls returned.
To the chair, I'm sure that AD Scott is taking copious notes because you're referring to the programs through CD for the money to make the repairs, right?
Right,
Yes.
right. Yes.
Yeah, I think what you're narrating, Councilman, is such a critical point because to the average consumer within the city of Cleveland, they're not differentiating between all of these programs. They're not saying, oh, this is the Lead Safe Coalition, CHN, Windows and Doors money versus the city of Cleveland's community development money, and I had a good experience here and a bad experience there. It's going to take all of these different, first of all, there's many doors in right now, and I think some of what's happening is trying to make sure that there's one door into the city, maybe one door into the coalition, but there's sort of a set number of doors, and then a real focus on that customer service experience, that when people are contacted, they get to the right place. And I think that is sort of a universal goal across all these different systems. So I just think what you said is so important because that highlights exactly what we're talking about today.
And you know what, and Councilwoman, and I'm going to yield, 1 second, give me 1 second, and I will yield to you. Councilmember Starr cousin, Ms. Taylor, I think it's 2 or 3 children that she have.
She got twins and a little girl.
They're walking around in a lead house. And we promised her that we were going to take care of that, and it didn't happen. So when she narrates her story and they see the little children, like we were talking about earlier with little kids, you can't win when children are not being taken care of. And people see the little children, these are little babies. And we know that Ms. Taylor's house is lead infected and people will not return her phone calls. Councilman Starr, no?
Yeah.
He knows about it. I'll yield to you, Councilor.
Yes, thank you. Thank you, Chair. I just want to make a point of the statement of universal of information and resources. When I met Karen back in, before COVID, when Blaine Griffin gave Kim Foreman the lead on the lead safe resource in the Glenville neighborhood.
Home of the Mighty Tablet.
Exactly, and we were over there building the system out. One thing that we did, Chair, to what Karen knows is we had classes. We have event classes for the constituents all through Glenville. And we broke them down in sections, like in the merchants, churches, libraries, houses. So at that time, we gave separate classes all through Glenville. Exactly. We had classes for all the constituents, and then we had community events specifically for the lead, for the lead safe resource information, and they came in droves. So I think that's the equation that has been missed. The constituents have not been engaged in the future process of the changes of this lead compliance agreement that has been changed since then. So if we go back to the basic to apply an event for the constituents to come out and have those questions again, I think they will be better understood for them to know that the process is still working, but this is the changes of the process. So that's why it's kind of slowed down a little bit, and now this is where we at. And I think if we start having just lead resource events only, and they come out like they used to, I think it'll be a better understanding on how the process is working, because also in my ward, I have constituents getting their home, getting lead safe, getting their home lead safe. And their biggest question is, what is the next move? I haven't heard from the contractor. He was here 2-3 weeks ago. I don't know when he's coming back. I don't know the next move. So, of course, I agree with Chair, because this is the breakdown of what's happening. And I think that, your team need to get together and perfect a big event for lead safe questions only, and then I'll have it sectioned out in the wards per se, or maybe like 2 wards or 3 wards together in the different areas, and I think that would be, more effective. Thank you. Thank you, Chair.
Here's the piece. You're advertising, and you show the little kid, and you talk about prevention. But we need to show outcome measures, and we need to show how we executed, and we took care of, it was great. We hit our goals and objectives with Ms. Taylor, with Ms. Crowder, and you make them friends, and they'll carry it. It's a campaign. It's a campaign. But when the councilman is walking his neighborhood, and people pull me over, and Ms. Crowder tells me, Councilman, we talk with so-and-so, and I don't want to mention people's names, on the phone in community development, but he said he would return my calls. You make promises to people, and you don't return their phone calls. To even tell them that, you know what, I did promise you this, Ms. Crowder. However, can you give me another week or 2? We're behind in staffing. It's that culture. It's the behavior. When your culture is not a culture of executing, but you say you're going to do certain things, it can work against us. And then you go into Glenville, which the grant is not working right, and I host community meetings there. they don't see good outcome measures. And when they start seeing victories and win, then you'll start hitting your 2,700 numbers because people will talk with each other. And that's very, very important. That's important for me also. And it shouldn't be that the council member, you look up and he or she, they're in your office looking right at you. It should be that your people execute well, and then we can spend less money on advertising because the advertising will be, they're doing a good job. They're doing a good job. And so I need us, I gave you Ms. Taylor's number. I narrated to you Ms. Crowder and Ms. Warren number. You should be writing that down and give me some feedback on it so that I can talk with you. You let me know where they're at. I can go see them, and then we have good outcome measures. Because the residents, they're our bosses. Plain and simple. They're our bosses. I'm almost finished. I know we have, I think probably the problem is two things. Execution, because I sit back and I listen. Director Scott, your contract shortages, probably. And then in Glenville, the houses there, they're huge. They're mini mansions. And so you might say you did a budget for 10,000 or 12,000, but we might need more than the 10 or the 12,000, and we can't get it done. And so that hurt us. But communicating back with that and evaluating it, our issues and concerns, and giving it to HUD, then they know where we're at. And I heard you when you mentioned contractors. They just need to know that. I'm almost finished because I'm being paged out here. Make the lead application simple, that's good. What is the average wage?
To the chair, to the councilman, I have to get that exact answer back to you because depending upon the funding source, it's set at different levels. Maybe at 60% AMI for one program, maybe at 80% for another. So I'll get that answer back to you.
Are you talking about the wages of the inspector?
Yes. A lead inspector or average wage for just working in the program.
I apologize.
You narrated it to me, the average wage, and some people don't like the average wage.
While I'm looking for, to the chair, to the councilman, I'm gonna look for an email that gave me much more precise information so I can give it to you dollar for dollar. But in short, while I am looking for that, the challenge is the recent contract allows for 3 levels, whereas previously I believe it was 5. Those 3 levels, if you come into the city and you have only your interim RBI, residential building inspector, you're coming in at base.
I got you.
You're coming in at base. In order to get a step 1, it is you have to have your residential building inspector license, not your interim anymore. You have to actually have the license. Then you also need to have your lead risk assessor and lead abatement contractor. Those 3 are just to be able to get the step 1 letter. In order to get a step 2, you have to have those 3, and once I find this email, I'll remember that 4th one, because it's actually not something we even utilize, but I have asked Assistant Chief Johnstone to look into it so that we can understand the value of that and possibly get it as an opportunity for our inspector staff. So
Right.
that way we can make sure that they can qualify for that step 2. But for someone coming in, it's just not attractive. Even, one of those candidates, I even had a very candid conversation with them because as I understood this person, thank you, Ashley, our HR lead is watching and just sent it to me, so it's at the top of my head.
Yeah, what is, yeah.
So it ranges from $25.50 to $33.01.
So we're looking
That's
at,
the hourly.
so that's around $50,000 to $66,000 a year.
They're high 40s, low 60s, depending upon where you fit on that step 1, 2, 3. But again, to one person, I was very candid with him. I read to him what the rates were, so we knew it wasn't a negotiation game. I let him know what the increases would look like as of the increase in April that's expected because of that contract.
Right.
And I told him, I said, if you're somewhere where you're working in the trades, or he mentioned he was working in a warehouse, not really working in the trades like he would want to. I said, come on in. I said, I understand what the wage is, But
Right.
appreciate that if you're here, you're getting actual assistance from the city in getting the training paid for. He was supposed to get back to me. I didn't hear from him. I'm not chasing anybody, to be clear. But from what I understand in a recent bi-weekly report I read as recent as this morning, he's still been having conversations with Assistant Chief Johnstone. So what I asked is a position even open? Because what I appreciate the requisitions closed. Whereas we invited him in, we interviewed him, we wanted to bring him on, that doesn't stay open forever. And so that's where I'm at, trying to find out if that person would come in or not, but they were non-responsive the last communications I had with them. So unfortunately, I mean, and we was really looking to bring this person in, but I'd be remiss if I didn't reiterate. 39 applications received, 4 actually were qualified. Of those 4, 1 actually wasn't qualified. We were under the impression he was qualified until we started engaging in discourse. He was not, so he didn't even count in that regard. So 3, 1 leveraged us, 2 we extended offers to, and it wasn't an acceptable wage.
So Director, let me ask you this. Could we cultivate some workers that's here already that want to move up? You know, for example, the city would pay for them to receive certifications, to go to school, to get certified for certain things, and because, you know, you have to cultivate the workforce.
Sure.
Assistant Director, we realize you don't have a mic right now, so.
Oh, you know what? You know, Director used to talking with me one-on-one. I stopped by and I visited him a lot of times, as well as Director Building and Housing, and the other Health Director. We just stopped by. So he's,
Yes, sir.
we have
It's
conversations
conversation.
like this. Yeah, we do.
sir.
So
Yes,
he didn't look at the mic. You know, that's Kev that he's talking with.
So, so to the chair, to the council person, excellent idea. And we recently, myself and Emily recently had conversation with Workforce Development about that very issue. We were more so in full transparency talking about from the contractor pool.
Yes.
How do we better reach out to the schools? How do we better reach out to our partners in the community, urbanly and so forth?
Right.
And try, what can we do to better our relationships, and then try to build into the community of workforce development piece. Part of Gina's contracts have workforce development as components. We would like to be able to emulate what Building and Housing is doing, is expanding their staff to take on certain certifications. Now, the challenge with ours is our inspector staff is a very small component of community development as a whole. So we haven't had any real spirited conversations about it because everyone's already in different silos doing the work that they do. But again, we need more people. We need more people to the point that we can actually retain them, you know, and give them other
retention.
opportunities. Yes, sir. Yes, sir.
You know what I would do? I know it takes a lot of time, but I only have 2 more because being paged out here. You have council that's here, and we have lovely newsletters. I would talk with Joan Mazzoline and make sure if you're recruiting staff, because our people want to work, and you know that Cleveland is one of the poorest cities in America. It is, and I hate that, but it's true. We could put it in our newsletters. Hey, look, we're looking for this, we're looking for that, and put it right in our newsletters. You know, because we want to put people to work. We believe in the power of work, and just put it right in the newsletter. Council lady, councilman, council lady, Councilman Conwell. That's Joan Mazzoline. You reach out to her, and when we do our newsletters, you get it out there. Some things that you need, because it reaches all of our residents, and we'll put it there. And I think also, instead of, because the reason we were going to call this meeting, but you had just got into your new position earlier, I think that on a bi-monthly, we should have a scorecard or a SWOT analysis where we're at instead of waiting for a hearing. We should have that. I mean, it's rightfully so. We have oversight. And that way we know, and at least come to me and I'll give it to the committee members, and then we know. We can do prevention that way. And I'm going to yield Glenville. Glenville is, who is over Glenville? I'm not happy with Glenville.
The grant?
Yes.
Community
The
development.
to the chair, to the council, both the Cleveland Citywide and the Glenville Grant fall under community development. That's us.
I mentioned to the last commissioner that I would go out with her. Been so busy with, it's not her fault. I mean, communication goes both ways. I want to walk with, if there's any issues and concerns there in Glenville, I don't want that grant to, for us to lose the Glenville grant. I don't like losing anything. It hurts my residents. But if there's any barriers, you could talk with me. I know almost everybody in Glenville. You know, I've been there for a long time.
Few days.
Yeah, for a few days. So I could reach out to them. You know where I live at. You can stop by my house, knock on my door, say, hey, Kev, here's an issue and concern. We need to get in, or there's a barrier. And then I'll talk with them and they say, hey, Kev, how you doing? Boom. And then, I mean, I'm open. We got to make that way, and I don't want to lose anything at Glenville. So if you're sweating, you know me. Just like we were just communicating. You say, hey, Kev, this is what's going on, and I'll put time aside, even if we got to walk 1 or 2 days, whatever the case may be, I'm there.
Right, and to the chair, to the councilman, I completely agree with you, sir. To a couple of points that you mentioned regarding the staffing or the communication, I'll definitely reach out to Ms. Mezzaline regarding that. Part of it, and I'll find out, I'm speculating, but part of the challenge may be that by the time your newsletter goes out, the positions have already been closed because it is a short window. But I can find out from her what that looks like. But what we have been doing is being very aggressive about not only just putting them through the city mechanisms as far as how the city sends them out, but posting them on our respective personal LinkedIns. We're all putting those positions out as much as possible, and I know that they've been hitting outside of our networks and being shared outside of our networks. So we're doing our best to try to do that. When we do finalize the contractor flyer, though, you can definitely rest assured that that's going to go out to all of the council persons so that way you can share it in however many mechanisms you share things. So you can definitely expect us to partner with you in that regard.
You know what, Director, can I interject real quick?
Please.
The newsletters go out. It's an ongoing process. For example, mine went out a week ago, but she's always working on other newsletters. Like Chris Hart's might go out next week or whatever. It's not just a steady quarterly. It's just ongoing.
Noted. So thank you. So I'll definitely reach out with Ms. Mezzaline about that. The only other thing was just about the communication. I fully agree with you. One of the things that I aggressively and pushing the team to do is be responsive. Be responsive. At this point now, the inspector team, they have a administrative day. They were working at such a capacity that it was hard to get things done. So I benched them every Wednesday. That's when they're there for any kind of training they need to do, as well as a set time to be able to communicate and work on their respective caseloads and to be able to get some solutions that when they're out in the field, they may need somebody that's in intake working on a contract, for example. No, you're now here. You can see each other. You can engage with each other. So, and in that space, part of that administrative is reaching out to people, scheduling, being responsive to your communications. So that's an improved part of our culture where it's an expected mandate to be responsive, timely responsive. But to that end, if you ever, and this to any of council, don't hesitate to forward me any complaints or concerns you get about our responsiveness, and we'll make sure that we reach out to the citizen. As in past roles, they have my phone number.
Right. So Director, I'll talk with you, if not today, no, I'll give you some time, maybe Wednesday, about these 3 individuals here where we at with Ms. Crowder, Ms. Warren, as well as Ms. Taylor. I'll give you more information.
Thank you.
Because you can't just know by the by the last names.
Right,
But I don't want to.
Well, no, to the chair, to the councilman, whenever, if you can send me emails with names and addresses, I can proactively start any kind of research, or we can do it at a phone call, whichever works easiest for your schedule.
Okay, and I know what's going on. With workers, sometimes, looking at the city, we talk about we have lack of workers. And I don't know, are the unions stopping us from doing it? Training is ongoing, we know that. Cultivating team workers is important. But do they let you do job enlargements? For example, you have a workload from 1 to 10. But somebody might be out sick, or you might have a staffing problem, what's going on. And if you do job enlargements with some of your workers, then we could cover some of the staffing shortages. And attrition always happens. So instead of saying that we have to go out and recruit people, recruiting is ongoing.
To the chair, to the councilperson, I'm not quite sure I understand what you mean by job enlargement.
Job enlargements, you give people a workload. You say, here's your workload from 1 to 5. Let me say Slife is out, Councilman Slife is out. So what I would do, me and job enlargement, look, Chris, you need to do from 1 to 5, then you're taught to do from 1 to 8. Also, Councilwoman Gray, you cover that other piece there, and your job enlargement is to do that. And so that way, because they're cross-trained. It's like someone filling a chuck hole in the city, and right across the street there's another chuck hole, but you wait until Councilman Starr call you up. Job enlargement, you fill this chuck hole in, and if that chuck hole over there needs to be done, you do that one also.
Sure.
That's efficiency.
So to the chair, to the councilman, I agree with you. And to the extent we're able, there are some people that are working above and beyond their class.
Right.
But you also have to appreciate that part of the challenge. In the space that we're talking about here, we're talking about inspectors. That's a very specialized
I
and
understand that
certified
part.
skill set, and it's a union position. So you
I
have to
know.
be very
That's why I
leery
asked you,
about
yeah. That's why I
how
asked
you
you.
use people outside of their capacity. But it is something that's a common practice, and I'm about 5 people right now, so it's commonplace. As far as succession and attrition, I agree with you. In my 5 to 9 world, as an attorney or as a counselor, I'm always trying to encourage businesses to be cognizant of succession. But again, it's slightly different in the world that we live
I
in
know.
here, because in order to be constantly recruiting, you actually need to have a position that's open and a vacancy that's available to fill. So at this point, going back to the inspector conversation, we exhausted that, it's now closed. It wouldn't be a prudent use of time to put it right back out there right now, versus once we get the bureau chief staffed, and then we
Right.
get the chief, and the implementation vendor has been, that RFP has been closed and posted. And then at that point, we'll go back and revisit how do we assess new inspectors. But minus the restrictions that I laid out, we try to have people working in multiple capacities, and if need be, adjust salaries accordingly. And then a lot of the team during our reorg has found themselves in different roles that fit their skill set more than where they equally
Yeah,
work.
I like that, I like that.
So there's been a lot of opportunity for internal promotion, as well as expanding the role of that individual person.
Like, with attrition, with me, if I was recruiting people and there's 5 applications, I turn around and hire one person, and I see the other person that I did not hire is equal or not equal, you guys don't get mad with me. Man, I'll keep 1 or 2 applications over there and continue to keep, so this other person might quit on me, so that way I have a contingency plan to bring somebody else in. Or you may have to terminate someone, I have a contingency plan to bring someone else in. And you always do train your workforce. I mean, that's the way I was taught to think.
To the chair, to the councilman, you're not wrong. Again, it's just, we need to have a position open to actually bring somebody in.
Yeah, I know it's different here, but, I got texts a couple of times after someone just meeting me out here real quick, and I'll be right back. Thank you, sorry.
Thank you, Chairman. All right, I think we are next moving to Councilman's Life.
Thank you. On the slides about the eligibility for the lead control grants, my first question is to qualify as low income, is that low income as for owner occupied and renters?
To the chair, to the councilman, if you can indulge me for one moment, I'm pulling the slide back
Sure.
up.
Maybe that's it. Slide, Tony.
Oh, thank you.
Is that it?
Next.
So there's one, lead hazards must be identified, the family living in the home must qualify as low income.
Two priorities,
It's,
I'm sorry.
it's the one, there you go.
That's it.
So, I'm sorry, to the chair, to the council, could you repeat your question?
So I'm wondering if, to qualify as low income, does that include that you're a low income renter?
You're asking if it's either the family or the,
I guess, so it makes sense that someone would qualify if they're a low-income owner occupant. However, I'm trying to suss out if you are a low-income renter, we are setting income restrictions
to the,
regardless of the income of the actual property owner.
to the chair, to the councilman, yes, it's the family.
Okay.
It's the family.
So in theory, just silly analogy, but the home could be owned by Jeff Bezos, but if they income qualify, they qualify for the
The
grant.
family will qualify.
Okay. I'm actually not opposed to that. I think we should be trying to get money out the door. And I worry that some of our own qualifications are more focused on, like, are more of the HUD model. And since this isn't HUD, do we need to be breaking ourselves out of that mold? The other question I have is there's another slide that says that property taxes have to be current. I think that's the next, nope, right there. Bottom bullet point. Property taxes must be current on the property or be on a payment plan. Is that is that legally required, or is that policy at the City of Cleveland?
To the chair, to councilman, that's actually a question I don't know the answer to. I can find out for you. It's part of, again, demystifying the application. What have we created as a hurdle versus what is a HUD requirement?
Sure. And again, just to correct me if I'm wrong, this is not HUD. There are no HUD dollars here. There's no reason that we need to be following HUD.
To the chair, to the council, this is HUD.
This is HUD.
These are the Glenville and the citywide that are HUD.
Okay.
These are not to be confused with Ms. Ventre's conversation about the grants coming through the ARPA dollars.
Okay, that's useful. And my concern is then, like, I've long been, my criticism of HUD is I think unintentionally we exacerbate poverty, or the only way we're not moving people out of poverty. We are relying on them to be poor in order to expend the dollars, and we don't seem to have a plan. And I guess my concern for this one with property taxes is if you are a renter, you have no say over whether or not the property is current with property taxes. That's not what you should do. But even if you're an owner-occupant, if our goal is to remediate homes of lead to help children, the child is also not responsible for paying the income tax. They're being held liable for something that they that they just do not have any control over. So I want us to explore how we can be less stringent, and just a lot of these requirements seem to align with other programs, and we don't, just staying on property taxes, if it's the case that this is policy and it's not required by the dollars, we're not looking at property taxes for garbage collection. We're not looking at property taxes to use a rec center. We're not looking at property taxes to speak at council. Like, this is just a service we offer. And I worry that we are not spending dollars because we are holding children further as victims for financial arrangements that they certainly have no control over. I would like to just get the dollars out the door, and I don't care if someone is $1 over income. If they're able to use the dollars tomorrow and that's one child that isn't poisoned, I think that's great. So I just hope that we can have further conversations about loosening our own guidelines so that we are less restrictive, able to get dollars out the door, and take a people approach instead of a property approach. Thank you.
To the chair, to the councilman, I 100% agree.
Great, thank you, Councilman. I think I have Councilman Harshon as the last one. Anybody else? Okay, last.
Cool. Well, thank you, Chairman. I'm just going to go in order that the questions popped up as we went through the presentation, so I'll probably be bouncing around a bit. But off the top, through the chair to the Director Martin O'Toole, it looks like we're estimating 94,000 rental units in the city of Cleveland on one of these slides. And I'm trying to wrap my head around how many people have taken advantage of the incentive-based
Units.
programs, money by rooftop. not, you know what I mean? So if there's like 94,000 rentals, the number that was on one of the slides was 2,531. Is that total, through the chair, is that total number of rooftops that have been invested in, or what is that number exactly?
Through the chair to the councilman, can you just rephrase that? Because I'm a little confused as
So
to
there's
what your question is.
94,862 rental registry units.
Correct.
Okay. So that-
Units, total units, like apartments in a building. That's not,
That's units,
Yeah.
not buildings.
Right.
So okay. So through the chair then, what's our estimation for number of rental rooftops? You know, a house has 2 units, another house has 1
yeah,
unit, that's 2
it's
rental
like
rooftops.
32,000 units.
32,000,
Yeah.
okay. So through the chair then, so we're at, we think 2,531. Is that unique addresses that have taken advantage of the money? Okay. Great. And then when we say 1 to 3 units, we mean the building, not the landlord.
Yes.
Okay, we're not, okay. There's a difference between a landlord that has 1 to 3 units and a landlord that has 10 1 to 3 unit buildings. Okay, we're talking about the buildings. One of the points made was that there is, quote, unchanging poisoning case numbers, which means case numbers are not going down. And I suspect we won't see case numbers go down dramatically until we have about a third of the rental units actually fixed. That's when we'll probably start to see just a numbers game in our favor. And if we're doing about, I added the 318 from Q1 of this year to the 2,531, it gets us to 2,849. So we're about 5 years away from hitting a third of all rental units. And that, I'm curious, is that a good trajectory? If we're 5 years away from seeing significant declines, would we consider that good, or would we consider that?
I don't, through the chair to the councilman, I don't consider that good performance. But I think when you compare us to peer cities, yeah, we're better than peer cities. But that's a low bar. That's not the bar we want.
Yeah. Okay. What's going through my head is this. So I did about 3 or 4 dozen lead clearance exams in 2021. And fortunately, I did them for the most proactive, responsible landlords in Cleveland, the people that heard about the lead safe registry and immediately jumped up and wanted to get their units tested. The majority of these units were a dream come true, and anybody would be happy to rent them. But what dawned on me as I was doing the lead clearance exams was that the most productive thing I might be doing that day was talking to the tenant. Tenants with children who don't know anything about lead, and I could explain it to them while I was in their house for an hour and a half. I could take the time to talk about dust and windows and doors and stuffed animals and things kids put in their mouth, and that seemed to have a real impact on the parents who were there who didn't know any of this prior to me showing up. And I worry a bit about the lead clearance risk assessors who are out there, because when I was at Metro West CDC, we were charging $150 for the first unit and $100 for all additional units. We wanted our price to incentivize people to comply and not use our price as a way to disincentivize people. And now I hear about these exams costing $500 each. And this, to me, sounds like a bit of price gouging. It sounds like a small group of qualified workers taking advantage of a large need and actually pushing people out of an interest in becoming compliant. I know that the CDC's charge, I think now they're up to 200, 250, and I think there was some, maybe I was being overly generous with my time. But I'm a little bit concerned that the private market is working against us in the lead clearance field, and that we need to get more nonprofit workers into this field so that we can drop that price down, because landlords are upset that it's costing $500. And the worst part is if the lead clearance examiner walks in and fails you on a visual and charges you $500. I can fail you on a visual in 10 minutes, right? I can walk in, look at something and say, well, that's not going to pass. That's a failed visual. But I would never charge anybody for that. If I walked into, I told every landlord to meet me at the first unit. I'm going to walk through and tell them how to pass visual and how to pass dust wipes and how to make a place lead safe. And I would walk through it, and I would explain to them the points where they fail, and I would say, I'm not going to charge you for this. This is a courtesy. But I'm afraid that the private market is doing that as well, charging people $500. Through the chair to the panel, is my experience in this just, am I different from you all? Or are you guys hearing some of this as well? Is there any confirmation of my feedback?
Through the chair to the councilman, yes, there's confirmation of your feedback. We also share concerns similar to yours. One of the reasons we want to stand up the 1 to 3 family lead compliance unit is to provide that free lead risk assessment to as many landlords as we can work with to help get them to the point where they can pass a clearance exam.
Okay.
So we do share your concern, and I just think the way the program was originally conceived to be a job creation mechanism was well considered, but there is also some concerns, as you've stated.
Yeah. So through the chair then, is it Ms. Ventry? Okay. Is the Mount Sinai money eligible for people to pay for a lead clearance exam? So if a landlord says this is too expensive for me, I'm a retired person. I've got 2 houses. It was my sister's when she passed away, but I want to get it done, but I can't afford the $1,000. Can she apply to get money to do the lead clearance exam?
I don't believe so, but I can get you.
Oh, you have to turn that on.
To be clear, the incentive is after you've cleared the process. So after you get the check, it is unencumbered money for the landlord. So that incentive money you can use to reimburse for the cost of the test.
So it can't.
Yeah.
Yeah.
And I want to make sure you have a mic when you talk, Karen. I'm sorry. I'm on
Right in front of you.
patrol.
Yeah, I just want to be clear. So that incentive payment only comes after they've presented that lead safe certificate and gotten that lead safe certificate from the city.
Yeah.
So they got to get the clearance exam.
Right,
So
so
yes,
they're
they
paying
do
for all
have to
that up
put
front.
money up front.
Right, so
Yes.
that's the problem. So we're going to lose a lot of people who don't want to pay that up front, and we need to maybe think about ways to make some of these funds available for people to get the clearance exam in the first place. Speaking of clearance exams, though, there was a list in here of failed submissions and the reasons that submissions fail. And looking through it, they're all risk assessor error with the exception of actual failed dust wipes. A failed dust wipe is an indication of a failed test, and that means the unit didn't pass the clearance exam. But everything else was an error of the person submitting the report. Is that the majority of the problems that we're seeing, is just the paperwork side?
Yeah, correct. And they're just not performing the inspection. All the pieces and parts are not coming in, or the visual clearance part is kind of being rolled over, where they're emphasizing those lead dust wipes when they really need to start at the beginning. And the clearance technicians they're looking for the income.
If I recall correctly, you should never conduct an actual dust wipe unless the visual exam has been passed.
Absolutely correct.
Right.
Correct.
Right. I mean, it almost feels like a no-brainer, but nobody. Okay. So that's an issue for the lead risk assessor industry. Question through the chair to, I believe, Director Martin O'Toole. For people that are coming up on their second round of compliance, have we discussed the amnesty until we reach a higher compliance rate for first time? Has that conversation been brought up?
Through the chair, you've brought it up.
Oh, hey, look at me.
Numerous times, and I think, one of the amnesty pieces that you might be referring to also is, working through this 1 to 3 family process. But for the people who have failed to re-up, we're more aggressively right now just going after the people that never.
Yeah.
Right. That my focus right now is the people that never complied.
Yeah.
Versus the ones that did and now they're lapsed. We're reminding them. We're sending them letters, but obviously, we still have people who've
But we spend our
complied.
enforcement time on people that haven't tried at all.
Right.
Okay, that's good. The $4.9 million for state, I just want to contextualize that. The $4.9 million that the state of Ohio made available for windows and doors, that's about 8,000 window replacements in the city of Cleveland. they're averaging about $600 for a window replacement, give or take, out there in the field. So that's about 8,000 new windows. If you figure a house has 12 windows, that's about 680 houses. So thank you, Ohio. That's cool, and we will definitely try to get that out there. But just to put that in perspective, that's a drop in the bucket. That might do, 680 houses is less than 10% of any of our wards. So I just want to put that in context. If anybody heard that number and thinks it's a massive amount, it's helpful, it's appreciated, but it's not going to solve the problem. When we talked about the number of lead blood hazards, and I think Dr. Margolius has left, it was 316 or over 10 micrograms per deciliter in 2023 and 1359 between 3.5 and 9.9. I know he said that we have an unchanging poisoning case numbers, but are those numbers consistent with 22 and 21 and 20, or are we going up, or are we just leveling off at the same rate we've always been?
I'll briefly just excuse Director Margolius. We got quite a bit of his time this morning, but unfortunately he had something he couldn't miss, so I'd like to welcome to the table Ms. Etoy Young.
To the chair, to Councilman. So the number actually has increased. We were looking at about 287 in 2021, 257 in 2022, and 316 in 2023.
Okay.
So it has increased. Also, the 3.5, so the below 10 has also increased as well, too.
Okay. And so through the chair, some of that I'm sure can be addressed by increased awareness, but most of these kids are coming back with EBLs from the state through routine medical checkups, which most kids were getting anyway. So there's also a temporary spike.
Through the chair to council, we do have our caseworkers that are also speaking with the families for the 10 below, and we've also brought in a few other, we have a Case Western student that actually is working with us temporarily to also make those calls. We actually go out to the houses as well too, speak to the families about cleaning, eating as well too. So it's not just, the cases coming in, we're also educating them as well.
Yeah. There is sort of a thing that bothers me, and it sits in the back of my head, and I don't know how to describe it other than just parental neglect. My kids were all raised in a house chock full of lead. There's probably lead on every surface and every wall. My house is built in 1942. I'm sure there's lead on every wall. And there's no EBLs in my house because we're aware of it and we take care of it. And I've done units and walked into houses where you can tell that the parents are not taking the basic steps to maintain cleanliness, and getting folks up to speed on the importance of that is going to be an uphill battle. It's something that just sort of sits in the back of my head on this. But through the chair, I think to Assistant Director Scott, there was a talk about inspectors using handheld machines when they go into houses. Is that an XRF?
Yes.
Okay. Through the chair, why do we require an XRF? It takes special training, extra certification, it's extra burdensome. The process and time is immense. Why are we using XRFs?
To the chair, not all of the staff, I believe, have been using them. Two of ours.
Oh, they want you to use the mic, sorry. You have to turn it on.
We had two inspectors, one of which has left, both of which were trained on an XRF gun. There's one inspector that still continues to use it, but we've not moved into training the other inspectors that have the certification to use the gun. It's one of those things that we're looking at internally, though, to your point about the cost-benefit analysis of doing so.
So we don't require XRF for all the units we go into?
No.
That your department goes into?
To the chair, to the councilman, no, sir.
Okay, great. Because XRFs are really only good for actually, if you want to get really dorky and like run the numbers of how many micrograms of lead might exist in a house, and an XRF gun can help you accomplish that. But otherwise, you just kind of know whether or not there's lead in the house. You don't need an XRF for that, right?
Through the chair to the councilman, they're essential for a 20-year certification, though. So we will be using them for that.
Yeah, through the chair, I'd be curious to know how many people have achieved 20-year certification through the use of an XRF to verify that all lead surfaces have actually been removed from a house.
Yeah.
121.
Yeah. No, through the chair, aren't most of those built after 1978?
No.
No. They wouldn't have to
No.
get it.
So the XRF would be used for the higher standard for the 20-year
Sure.
exemption. And you only end up having to go through either a 2-year or a 20-year or you know, a owner-occupied exemption if your house is built before 1978.
So we've had 121 units use an XRF on every single surface, painted surface in their unit, and get, okay. Through the chair, do we know how many units failed that process?
Karen is probably, through the chair, the best person to answer the question. We may not have it right at our fingertips, but
It's probably the highest threshold of burden of proof that you can get.
So HUD brought the, I mean, this is a HUD regulation also. If you're going to do a HUD home, you have to have XRF readings on what is actually documented as positive for lead. So they must shoot all the windows, doors, everything for the HUD funding. So our HUD grants are already using the XRF. It doesn't take extra certification. It does take a training, but it is a incredible piece of instrument to tell us where the lead is, especially for these 20 years. We got to know, because it might be good this year, a door might be good this year or next, and we give them a 20-year, and 5 years down the road, this door goes bad. If we know where everything is up front, then we can have a program and a system in place to get everything cleared so they can get a 20-year certificate.
Okay, so we're using XRFs for the 20-year exemptions and
To the chair,
And
to
it's-
council, we also use XRFs for our inspections as well, too. So
Yeah.
anytime that a property comes into compliance in which there's a landlord, we do redirect them as well to building and housing to get their clearance completed for their lead safe certification.
yeah, I would be concerned that we're raising the bar too high XRF. I mean, you're literally measuring the amount of lead in a wall. And the most important thing is to know whether it's there or not at all.
Well, for us, it's a state requirement. So it's not
It's a what?
something, it's a state requirement, so we
State
can't get
requirement.
beyond it,
Okay.
yes.
Okay, I see.
To the chair, to the council person, I didn't really, just briefly, I was talking with Karen, I didn't realize that to the extent we don't, it could actually hinder the efforts of building and housing, so we
I
definitely
see.
need to come
So
back to
we're
that
dealing with federal
conversation.
regulations. All right. Last question, comment. We're looking for houses with children under 6 to do interventions. And I wonder if, if swimming upstream in this context means not worrying about whether or not kids live there right now. A house that doesn't qualify because it doesn't have a child in it this year that has 3 kids in it next year. It seems a little bit like, why would we slow ourselves down if we have the ability to do houses, especially if it's a rental? There can be kids in it next month, next year, 2 years from now. I don't know why we would require a child to be there. And especially since, you know, Councilman Moore has pointed this out many times, we use children like canaries in the lead coal mine, right? We're finding out that houses have problems through the discovery of blood lead levels in children. But if we just go into the house and say, you know, this house has a lead hazard and we're just going to fix it now, well, is there any reason that we require the children under 6 be present?
Through the chair to the councilman, it depends on what program you're talking about, and I think one of the themes that is very well taken today, and one of the reasons we're here talking about retooling, is the shift that we need to make from relying on residents to determine their eligibility and the need for us as governmental actors to tell you what you're eligible for. So I think it's really important among the thread of programs that we have available, including home repair, to Councilman Starr's point, that we are the ones who are, you know, whatever it takes. If it's this ward tour that Councilwoman Gray was speaking to, we need to be there, letting people know what they're eligible for and
Yeah.
how to accomplish lead safety. So it's not, you're right that we need to talk to you all about which department's doing what for eligibility, but we also need to be telling the public exactly what they are eligible for.
Yeah.
So I think you're right that we don't want to slow things down with children being present. But it literally does depend on which funding stream we're talking about, and we need to be the ones who are saying, absolutely,
Yeah.
this home with a lead safety problem could move forward with repair through the following mechanisms. And
Right.
that's something that our compliance center, our compliance unit will be able to do in building and housing. It's something that
Yeah.
Assistant Director Scott's shop is working to do through their new intake specialists, et cetera.
Yeah, because at the height of the predatory lending fiasco, contractors were going door to door, just knocking on doors of people in Glenville and saying, hey, you need new windows, I can get you new windows, and then refinancing their house and, screwing them out of a home. But we could go door to door and say, hey, I see that, you have resources available to you that we could, come in and help clean up the house and maybe get some new windows. And do that with a City of Cleveland badge on, right? And it seems like the time to be proactive is now, because we don't need to wait for kids to live there. Overall, I think, Madam Chair, that we need good bureaucrats that can move paperwork, that can take applications and turn them into resources, and do that thankless work that happens at desks and at the other ends of computers and phones. Because when the number of units that have passed lead safe certification goes from whatever we're at, the low 4,000s or whatever we're at, up to 20, 30,000, that's when we'll see a dramatic drop in lead poisoning cases. And it seems like we just need to get over a couple hiccups here. But I'm very encouraged by the team and by the effort. And sometimes it might be a little unhappy sounding, but this is progress. This is a good group of people, and we're working in the right direction. I'm happy that you all came and gave us this thorough update. Thanks.
Thank you very much, Councilman. And I believe I will finish out with Councilwoman House Jones.
Hi, everyone. This is a long Monday, but I'm going to work to keep this brief through the chair to everyone. Good afternoon for being here. A couple of things. In regards to communication, this is one of the things I think is just a growth opportunities for all of us. And I guess really trying to think through how are we going to more effectively really communicate to people, right? I just, there's a major disconnect from all of us, and how are we gonna communicate this information? I hear people saying like, newsletters, and we have to do everything, right? We have to do phone calls, we have to do text messages, we have to do social media, we have to do the television. Like, is that a part of this plan to be able to communicate the information to to our community members so that people can know, like, what is the communications loop so that this information is shared? And what is the investment that we're actually making in communications, which is probably the bigger thing? What type of money? That's the question. How much money are we investing in communications to get this information out to people?
So thank you through the chair to the councilwoman, thank you for that question. I think each department's going to tell you a different number for their communications budget, but I think it's important to also state that it's a personnel issue that we need to deploy, meaning we literally need to have a place and person who answers the lead questions, right? So yes, it's the going out into the community, it's the publications to the community, and you're right that we need to do all of them. In addition, we need to be able to take a single question about lead and be able to answer it across departments. And I think there's a collaboration element to the communication question that is very much my role. So where we're deploying that, how we're deploying that, making sure that we are presenting to groups, you all included, as a collective is important to me. So I think I can have each department answer the question about money to the degree they know it, but I just want you to understand as well that I think it's a personnel question that, and deployment of certain tasks that we're solving in this compliance unit and with other, which you all have allocated money toward in this latest budget round, in addition to the communications budget per se. And I'll let directors speak to numbers if they know them.
That's why you guys have real money. Too.
I can't give you an exact dollar amount right to the chair, to council. I can't give you an exact dollar amount right now, but I know for us, the billboards is one of our efforts in regards to getting some of the communication out. We're also looking at radio. I know the Lead Safe Resource Center has been doing a lot with social media. Literally, you log in and different things pop up in regards to them, streams, ads in regards to, it may pop up just to kind of show like the one-on-one classes in regards to tenants and landlords as well.
Yeah, so we don't have to go through all of that. What would be helpful is if we can actually provide maybe the kind of summary of the actual communication investments and then what was the result of it, right? Because I think that's one of the other things we typically get into the habit of doing a lot of stuff, but we don't know what the stuff actually results in. And that's a global statement. So if we could just provide that type of information. And then as we're talking about people, I don't know where artificial intelligence is actually utilized in this, specifically as we think about how you already have ready-baked answers in a variety of formats, whether it's through a phone call, text message, so that when people are asking questions of us, then they readily can get the information because we've built the the AI system that can respond to them. I know we are far away from that, but I think it's something. As we are looking at like personnel issues, like this is how organizations are utilizing these things to really be more efficient and to be a better responsive to the needs. And so, I mean, probably working with, let's say, Urban AI, I mean, I think that could be something else that we can incorporate. The other question that I had through the chair to the team is just trying to figure out, do we have a date of when the repair stuff is going to be ready? Do we know when? Is it a date? As far as when people, the one from community development in particular.
Oh, yeah, Councilman Starr did ask a little bit about that.
I know, but I don't, do we have an actual date?
Yeah, no, I'm going to let it to Ms. Ventry.
Through the chair to the councilwoman, they're anticipating early April to get the home repair grants moving through the federally restricted ARPA Mount Sinai program.
You said, okay, what does that mean? Can you speak like more?
That's the $13 million Treasury investment to the Lead Safe Coalition. And so far, they have homes in the pipeline. They have not started the repairs yet, but they anticipate them starting in early April.
So the work is going to start in April?
Correct.
And but you're already taking applications for it right now?
So through the ARPA, the $13 million award, they stated that they have homes in the pipeline ready to go, and they would like to start moving those, and they anticipate start moving those in early April.
So through the chair to the president, so the homes that are already in the pipeline will take up the entire $13 million? Is that what you're saying?
No, it's just the budget amount allocated to home repair grants within that ARPA program.
Okay, let me ask you a real simple question. Can somebody else apply for this home repair program? And how do they do that? And where do you go to get the information?
So the coalition has contracted with Fairfax, Renaissance Development, Cleveland Neighborhood Progress, and Famicos.
Maybe I'm not asking right. Okay.
There are
Thanks.
also, are you referring to as well, we have the general fund ARPA home repair programs that are separate from this.
Mm-hmm.
Okay.
Is that one ready? The general fund ARPA home repair?
The contracts are being finalized as we speak. It has, I understand it has been a long protracted process, and we're really working to get that money out onto the street.
And when will that, through the chair, when is that one ready?
It depends on what agency it is, because we have sent money out to different agencies, including Habitat, Cleveland Housing Network, et cetera, depending on when those contracts are ready to go. The earliest I anticipate is later this month.
Okay. So you, I'm asking these questions, like, how are people supposed to, through the chair, how are people supposed to know this stuff? Like literally, I'm not doing funny. Like, I'm really asking questions because I don't even know how I could actually be helpful.
Yeah.
I don't know. I don't know.
I think Councilman House Jones, your point is exactly correct, and I think that it is going to take a broad base across these departments. So Ms. Ventry is helping to administer and get the grants out the door, but is not going to be the one giving out like the social media placards for when the money is available. And so I just want to make sure we know that that question is heard by community development, by the mayor's office, that this is a critical point, that this money needs to, if we want to get it out into the streets, people need to know it's out in the streets. So I just want to make sure that it's heard across the board.
To the chair, to the council person, just for clarification, what Gina's speaking about are the actual grants coming through ARPA and or general fund. Are you just talking about the everyday application that a citizen might want to complete?
Yes, because
Okay.
again, what you hear is
Okay.
there's money available to repair my home. I'm talking about general people, they don't know which program it's.
Sure.
How would you know?
So.
And how do you, because again, a lot of times I hesitate in sharing stuff, right? Because again, people get frustrated.
Yes.
Because it's not clear, it's not who. All I'm asking is, how can we get a little bit more clearer to communicating the right information to the right person at the appropriate time based on when things are actually made available?
So to the chair, to the council person, as would the average Joe and Jane citizen would care about is being able to apply for a program and getting assistance. You're able to find that on the city's website, community development. We know it's evolving. I'm not ITS, so I don't take it personal either way, but it's there. The lead application is there. Then there also is, we take applications in-house, our intake team, as well as the community engagement specialist. I'm not sure if the council person was here when I spoke about that. There's 12 in the CDCs, and then there's also, we're hiring 5 more internally. So there'll be, so you were here for all that. So, okay. So all of those are points where citizens can receive assistance in submitting and navigating the application.
Okay, thank you.
Yes.
Thank you very much, Councilwoman. I think it's a critical point. All right, I think we're closing out 12:04. I want to thank everybody for the time. I know that there's been a lot of work on this side of the table to put together this presentation and a lot of great questions today. So with that, I will adjourn this meeting of City of Cleveland's Health, Human Services, and the Arts Committee.